Today, we're talking about Briellyn, a combination hormone medication used to prevent pregnancy. It contains two hormones, a progestin and an estrogen. Aside from preventing pregnancy, Briellyn can also make your periods more regular, decrease blood loss and painful periods, decrease your risk of ovarian cysts, and treat acne. It's important to note that using this medication does not protect you or your partner against sexually transmitted diseases, such as HIV, gonorrhea, and chlamydia. For optimal results, it's recommended to take Briellyn at the same time every day. It's best to consult with your healthcare provider for the correct dosage and timing that works best for you. Before you start taking Briellyn, make sure to read the patient information leaflet provided by your pharmacist. It contains important information on when to take your pills and what to do if you miss a dose. Take this medication by mouth as directed by your doctor, usually once daily at the same time each day. You can either swallow the chewable tablet whole or chew it thoroughly and swallow. It's important to take this medication exactly as prescribed by your doctor. With certain brands of birth control pills, the amount of estrogen and progestin in each active tablet varies throughout the cycle, so follow the package instructions carefully. If you experience vomiting or diarrhea, you may need to use a backup birth control method. Taking this medication after your evening meal or at bedtime may help with stomach upset or nausea. Your pill pack contains 21 pills with active medication and may also contain 7 reminder pills with no medication. Take one active pill once daily for 21 days in a row, and then either take an inactive pill for 7 days or no pills at all before starting a new pack. If this is your first time using this medication and you are not switching from another form of hormonal birth control, follow the instructions in the patient information leaflet or consult your doctor or pharmacist. Some common side effects of Briellyn include nausea, vomiting, headache, bloating, breast tenderness, and swelling of the ankles/feet. You may also experience vaginal bleeding between periods or missed/irregular periods in the first few months of use. If any of these effects persist or worsen, it's important to contact your doctor or pharmacist. If you miss 2 periods in a row, or 1 period if the pill has not been used properly, you should contact your doctor for a pregnancy test. It's important to note that this medication has been prescribed because your doctor has determined that the benefits outweigh the risks of side effects. And while many people using this medication do not experience serious side effects, it may raise your blood pressure. It's recommended to check your blood pressure regularly and inform your doctor if the results are high. Seek immediate medical attention if you experience any serious side effects such as lumps in the breast, changes in mood or mental state, severe stomach/abdominal pain, unusual changes in vaginal bleeding, dark urine, yellowing of the eyes/skin, or symptoms of a possible blood clot. While rare, a serious allergic reaction to this drug can occur. Get medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed here, it's important to contact your doctor or pharmacist. Please be aware that you may also report side effects to the FDA or Health Canada. If you smoke cigarettes or use tobacco and are over 35 years old, do not use Briellyn. Smoking can increase the risk of stroke, heart attack, blood clots, and high blood pressure from hormonal birth control. The risk of these serious problems increases with age and the number of cigarettes smoked. It is important to avoid smoking or using tobacco while taking Briellyn. Before taking Briellyn, make sure to inform your doctor or pharmacist about any allergies you may have to estrogens or progestins, as well as your medical history. This includes any history of blood clots, high blood pressure, cancer, depression, diabetes, heart problems, kidney or liver disease, obesity, stroke, thyroid problems, or any other relevant conditions. If you have diabetes, this medication may affect your blood sugar levels, so be sure to monitor them regularly and inform your doctor of any changes. If you have diabetes, phenylketonuria, or any other condition that requires you to limit sugar or aspartame in your diet, be cautious when taking the chewable tablets. If you are planning to have surgery or will be confined to a bed or chair for a long time, be aware that this medication may increase your risk of blood clots. Additionally, Briellyn may cause dark spots on your face and skin when exposed to sunlight, so it's important to limit your time in the sun and use sunscreen. If you wear contact lenses, you may experience vision problems, so contact your eye doctor if needed. It's important to note that it may take longer to become pregnant after stopping Briellyn, and it should not be used during pregnancy. If you become pregnant or are breastfeeding, be sure to consult with your doctor. Drug interactions can affect how well your medications work and may increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not make any changes to your medication without consulting your doctor first. Some products that may interact with Briellyn include aromatase inhibitors, fezolinetant, ospemifene, tamoxifen, tizanidine, tranexamic acid, and certain combination products used to treat chronic hepatitis C. There are also some drugs that may decrease the effectiveness of hormonal birth control, leading to a higher risk of pregnancy. Examples of these drugs include griseofulvin, modafinil, rifamycins, ritonavir, St. John's wort, drugs used to treat seizures, and HIV drugs. It's important to discuss any new medications with your doctor and consider using additional reliable birth control. Furthermore, Briellyn may interfere with certain lab tests, potentially causing false results. Make sure to inform the lab personnel and all your doctors that you are taking this medication. When taking Briellyn, it's essential to follow your doctor's guidance and discuss any new medications to ensure the effectiveness of your birth control. If you or someone else has taken too much Briellyn and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. For residents in Canada, you can reach out to a provincial poison control center for assistance. Symptoms of an overdose may include intense nausea and vomiting, as well as sudden or unusual vaginal bleeding. Remember, it's crucial to seek medical attention if you suspect an overdose. Remember, Briellyn should only be used by the person it was prescribed for. It's important to have regular physical exams and medical tests while taking this medication, including blood pressure checks, breast exams, pelvic exams, and pap smears. Make sure to follow your doctor's instructions for examining your breasts and report any lumps right away. It's important to keep all medical and lab appointments. If you have any questions, consult your doctor for more details. If you miss a dose of Briellyn, refer to the product package for instructions. It is important to use backup birth control, such as condoms or spermicide, to prevent pregnancy. If you have any questions, be sure to ask your doctor or pharmacist. If you have difficulty remembering to take your pills as directed, it's best to talk to your doctor about switching to a different form of birth control. It's important to store Briellyn at room temperature, away from light and moisture. Avoid storing it in the bathroom, and make sure to keep it out of reach of children and pets. When it comes to disposing of Briellyn, it's important not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper way to dispose of Briellyn. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.